My name is Jennifer Huynh. I'm a third year midwifery student studying at the University of Technology, Sydney. I acknowledge the Gadigal people of the Eora Nation where the university stands. I pay my respects to elders past, present, and emerging, and additionally acknowledge the Gadigal people of the Durack Nation where this video takes place. My video diary, as per my strengths-based midwifery subject, allows me to reflect on my experiences, observations, and my learnings when working with women with psychosocial complexities and my role as a midwife to improve their health outcomes. As midwifery students, we're taking an oath to be of service, an oath to provide women-centered, trauma-informed care that aligns with the standards for midwifery practice. Throughout my video, I'll be discussing my topic of substance use in pregnancy and the significance of midwifery care guidelines and research articles that support gold standard care to women that have psychosocial complexities. I will also address the key factors that were done successfully, challenges I faced, and areas for improvement. I have been privileged to observe a fantastic midwife who is the coordinator of our safe start at the hospital where I do clinical placement. Seeing the impact that she had on these women, the glow in their faces, the restoration of hope in their eyes, is something that I will continue to remember and cherish. At that moment, I knew it was the same impact I wanted to have on women, to be their beacon of hope. I shadowed her and witnessed her communication style. While professional, still had that emphasis on being human. When shadowing other clinicians, it was always acknowledging what they have, but I always felt like they would talk to like robots. I noticed the importance of demeanor. It was one of the first times I witnessed what trauma-informed care looked like early on in my studies and the gravity it had on midwifery practice. This clinical experience mirrors how fundamental it is to acknowledge the trauma that women face and recognize them as a survivor of physical, sexual, emotional abuse, and a survivor of domestic violence. Instinctively, our personal bias may judge, but it's crucial to recognize that a majority of individuals that use substances in pregnancy were exposed to myriad forms of violence and use drugs as a form of coping mechanism. Providing gold standard care relies on a multidisciplinary approach to care, which emphasizes on providing support to sees usage communicated through a holistic outlook. This encompasses addressing psychological and physiological needs, such as emotional support and support to safely withdraw from substance usage. Understanding from a woman's point of view empowered me to successfully provide woman-centered, trauma-informed care. Hence, it's foundational in midwifery care to reflect on the midwifery standards for practice 2.2, whereby the midwife partners with women to strengthen women's capabilities and confidence to care for themselves and their families. When working with women that have psychosocial complexities, it was imperative for me to actively listen to her to ensure that I was able to connect her with services that will improve her and her baby's outcomes. That was something I did successfully as it supported autonomy through a multidisciplinary approach to care. I had the pleasure of taking care of this woman with a complex psychosocial history. To appropriately communicate with her, it was important for me to actively listen and understand her story to prevent re traumatization. I used words that encompassed trust, empowered her, and words that empowered me to work collaboratively with her, preventing a power disparity. I found it quite challenging in the regard that I didn't want to re traumatize her or say and ask the wrong things that might alter her view of the healthcare system, which is an aspect I will continue to develop and improve on. I communicated to my family by asking what I can do to make the experience better and asked a Safe Start midwife ways I can facilitate it. I constantly refer to the New South Wales guidelines for management of substance use in pregnancy, which empowered me to assist her with her recovery objectives facilitated through women-centered holistic care. It helps me to recognize the evidence-based approach to care, identifying any possible risks towards mum and bub, and ensuring that her autonomy is recognized. It supports me to guide these women safely to abstain from substance usage through my understanding the ways to prevent severe withdrawal symptoms. Achieving this guided me to ensure I was able to appropriately communicate with the woman, empowering me to develop rapport, prevent re traumatization, and provide holistic care. It illustrated the significance of intersectoral collaboration and the gravity it had on creating a positive impact for women with psychosocial complexities. Women that use substances, inclusive to illicit drugs and alcohol consumption, predominantly are confronted with complex social histories, such as poor mental health, increasing their susceptibility of intimate partner violence, and declining reproductive health. I recognize that trauma exists beyond the external triggers but can be additionally inflicted through epigenetics. I learned the importance of epigenetics and how it can be responsible for a woman's psychological state due to utero exposure, which altered her gene expression. I recognize that substance use can be influenced through genomic alterations from life in utero, but additionally can be externally induced through inflicted psychological and physiological trauma. If facing continuous trauma, the use of substances disrupts the pain receptors in the brain, inducing a euphoric feeling. Studying this subject enriched my understanding that epigenetics is a factor of generational trauma. This entails that her children and future grandchildren are at an increased probability to have similar trauma responses, inclusive to PTSD, BPD, anxiety, and depression. It was like a continuous loop. Understanding the epigenetic makeup empowered me to recognize the extensive types of trauma and how I'm able to connect women to the correct services. I cared for women who had a history of marijuana use and continuously used it throughout her pregnancy. Her baby needed additional care when it was born, but the thought of her being separated from her baby pained me. The baby that she grew, nurtured, felt the movement of, and loved would be taken away from her care. But I could see how helpless this baby was. It was on my mind constantly. I vividly recall the struggles that Bob faced and how innocent it was. But it was fundamental for me to understand that we have a role of being mandatory reporters to ensure that the best interest of the child is foremost. As midwives, we're mandatory reporters, which entails that any possible harm that is inflicted on a child needs to be reported. An ethical dilemma would be balancing bodily autonomy with the health of and welfare of the unborn baby. Supporting bodily autonomy refers to the woman's rights to her own choices and decisions regarding her health. We need to recognize that it can be used as a coping mechanism and guided to abstain through gradually decreasing the amount used to prevent severe withdrawal symptoms. I navigated this by understanding both the autonomy of the woman I'm caring for, but also the welfare of the baby. It was definitely something challenging for me, and an area where there is room for improvement and growth. Collaborating and shadowing the SUPS team will empower me to improve my understanding of substance use in pregnancy, which helps me improve my trauma-informed Reflecting on my topic of substance use and how I navigated possible challenges empowers me to provide women-centered trauma-informed care. Understanding that the women in my care are victims of psychological and/or physiological trauma enhances my ability to effectively care for them and their baby. Critically analyzing my previous experiences with women that have used substances throughout their pregnancy highlights key area for improvement, which promotes the woman to have a positive childbearing experience. Thank you for listening.